Okay.
Good afternoon. My name is Jason Osborne. We're here with the emergency management team. We're going to talk a little bit today about codes for the hospital and emergency codes. We're going to be focusing this segment on Code Blue and rapid response. For a Code Blue, that would be a patient in cardiac and or respiratory arrest, or that is completely unresponsive. You would call Code Blue overhead. And we'll talk about how to do that in a minute. A rapid response is any change in patient condition that you feel needs additional support from the hospital. That could be a patient who has had a diabetic emergency. It could be any type of condition that changes how the patient normally was. So if there's any change in mental status or any change in condition, a rapid response can be called. It doesn't matter who calls it. It could be a MHA, could be a PCA, could be a nurse, could be a housekeeper, could be a somebody from maintenance. Any hospital employee that sees a patient in distress or a change in status has the ability to call the rapid response. And by doing that, brings extra resources to that location. If you're here on the Southbridge campus, you would pick up the phone and dial *66, and that would get you the overhead paging system. Once you hear the beep from the overhead paging, you're going to say rapid response to north, rapid response to north, or wherever your specific location is. At that point in time, the operator will then repeat that page to ensure, and it'll also simultaneously page the nursing supervisor and the department managers so that they know what's going on, and will bring those additional resources to that patient's bedside to provide the best possible care we can here at Harrington Hospital for our patients. If you were at the Webster campus, you would dial *## for our older grayer folk. For our new, younger, thriving generation, pound or *## is the code that you would use to enter into the phone. You would get the overhead paging system, and you would repeat, rapid response CDU, rapid response CDU, or Code Blue CDU, Code Blue CDU. This will allow for those extra resources. You're going to get somebody from respiratory. You're going to get a medical doctor. You're going to get an ER nurse at the Webster campus. Here at the Southbridge campus, you're going to get one of the hospitalists. You're going to get, maybe an ER and an ICU nurse. You're going to get additional people here that can help, make decisions. And even if it's not needed, we can determine that afterward. We don't want to have you not call when it's needed. We want to make sure that we're providing the best patient care for our patients. So again, for calling a rapid response or a Code Blue, any hospital employee may call, depending on the situation, may call for a rapid response or a Code Blue. Again, at the Southbridge campus, to access the emergency paging system, it's going to be *66, and for our Webster campus, it's going to be *## or ###. Thank you so much, and stay safe.